Leukemia, we already did in cancer. Turn the page. Now, on this page, congenital heart defects, or congenital defect symptoms, whatever, put CHF. Signs and symptoms equals CHF. Congenital heart symptoms, you're almost done. CHF. Under all of these hearts, I want you to write underneath the word symptoms, number one complaint is difficulty feeding. Number one complaint by mom about this new baby is that they don't eat well at all. They fall asleep, they suck, and then go to sleep. Their mouth, circumoral cyanosis, when they try to eat, they turn blue around the mouth. Circumoral, C-I-R-C, circumoral cyanosis. When they try to eat, they turn blue. And biggest thing you can remember is basically this is CHF. Every single heart defect baby is CHF. Every heart defect baby is CHF. Now, you see where it says tachycardia at the top with the first heart? Put treat with digoxin. You see it says increased respirations. Oh, first of all, increased pulse greater than 160. Increased respirations greater than 60. Retarded growth, put delayed puberty. And poor weight gain. Delayed puberty, poor weight gain. Dyspnea, orthopnea, and put feed sitting straight up. Feed sitting straight up. So feed them while they're sitting straight up. And they may need tripod position. Where it says fatigue, make sure you know small frequent feedings. And the patient may have clubbing, because they have chronic hypoxia. Clubbing. Where it says upper respiratory infection, make sure you put flu and pneumonia vaccines. And HIB, Haemophilus influenza B, HIB vaccines. Make sure you put daily weights and diuretics. Daily weights and diuretics for all birth defect. All congenital heart defects. Count wet diapers. Count the wet diapers. Okay, next page. You don't care about asymptomatic, but you sure as hell care about cyanotic. Okay, the only thing you do care about acyanotic is this left to right shunt, highlighted. The reason it's acyanotic, please spell it out exactly how I say it. The reason why it's acyanotic is because the left side of the blood has oxygen, and all you did was shunt some of that oxygen to the right. So this baby is not blue. Left side of the heart has oxygen, and it just backflowed into the right. So that's not that bad. That baby does not need surgery at birth. Left side has oxygen, right side does not. You leaked oxygen into the right side. Who gives a shit? The one you care about is cyanotic. That baby is blue on birth. So cyanotic defects, I tell you to remember the T's for trouble. 4 T's equals trouble. That's what the problem is here. 4 T's equal trouble. Highlight tetralogy of Fallot is the number one cyanotic defect. Put at the top of that paper, right to left shunt on the heart sheet with the 4 T's, right to left shunt, and then turn the page and highlight the same thing. So Just highlight every time you see a right to left shunt. Now, the difference between a left to right shunt and a right to left shunt, if you go back to a cyanotic, just put these babies have loud murmurs. These babies have loud murmurs. Acyanotic, loud murmurs. Go down to the bottom and highlight murmur. Heart murmur. Okay. If you turn to congenital hip dysplasia, I want you to remember this hip is shorter. You gotta highlight it because it's on there already. Oh, it says asymmetrical gluteal folds and shortening. Do you have one?
Yeah.
Okay, this is not hard. Congenital hip dysplasia is exactly what's written. Asymmetrical gluteal and thigh folds. You definitely have to know that. On the affected side. And then the shorter leg. Now, you need this baby, when we have this problem, we've got to give them, oh, there's something else. Is it on here? Oh, it is, good. Ortolani sign. In the box above, it says Ortolani sign. We've got to give them a spica cast. We used to just cure it with diapers. But now we have to keep the hips abducted, just like a grown-up. Swaddle the babies with the hips abducted, and you need a car seat with a wide base. We use this fancy word, Fallot harness. Assess the skin frequently or breakdown, because it's basically rough. Okay, babies. If you write these two down, that's all you had to do for abdominal wall defects. I will put it on the sheet. Gastroschisis, Omphalocele. Write those down. If you can write down myelomeningocele, make sure you put for myelomeningocele that the baby needs to stay prone. The baby needs to stay prone because this is the spinal cord coming out of the back, a hole in the back. But it's in a seal, right? So what does that seal mean? I've taught you guys that these words, these letters right here, means a sac. Everything is caught in the sac. Big old sac of spinal cord and fluid coming out their back. What do you put on these things? Normal saline. To keep it moist. Hydrocephaly. This is where the head circumference, and I'm going to write it up here, head circumference is greater than 3 centimeters, from the chest circumference. The head is supposed to be the biggest part of the body, but not more than 3 centimeters in the chest circumference. So look, you measure the head above the eyebrows, all the way around. You measure the chest at the nipple line. This baby's head is more than 3 centimeters bigger than their chest. That's what I'm saying right there. That's hydrocephaly. Their eyes, the pupils in their eyes are called sunset. Now I know it's late, we're about to get up out of here, but look at each other, even if you're ugly. Just look at each other real quick. Do you see the whites of their eyes above the person sitting next to you? Look at your child, honey. You can't see the okay. You should not see the whites above their pupils. Oh, okay. If you do, that means that the pupils are sunsetting in the lids. The intracranial pressure with hydrocephalus is pushing their eyes down. Okay, so you should not see the white above the eyes. This baby needs everything anybody else with ICP precautions would need, right? But it's a baby. So you're watching for bulging, fontanelles, projectile vomiting, seizures. This baby needs a shunt, and they will have several surgeries because the shunt has to grow with them, so they always need more. Oh, thank God.